Let's get back to our top story. The health care debate running across the United States right now. As we showed you only a few moments ago, Republican Senator Charles Grassley of Iowa is holding a series of health care reform town hall meetings today in Iowa. And while they're turning out to be a lot more civil than some of the Democratic lawmakers are facing elsewhere, there are passions that are clearly being expressed.
I totally want health care coverage for everybody and some kind of national approach to it, but I don't want to rush into it. I'm not saying single health care system. I'm saying I want to have a system that covers everybody.
Iowa resident Mary Terry is joining us now from Des Moines along with Craig Stevens. He didn't get a chance to speak today, but I understand, Craig, you did have a chance to speak with Senator Grassley afterwards. What point did you make to him?
Well, what I said to the senator when he got done with his interview was that I appreciated him being here and that I felt that he had listened to our concerns and answered our questions. But I mainly wanted him to go back to Washington and let the people know that have been calling us un-American and calling us mobs that we really can be civil and that this is a discussion that we should be having. And this is what America was founded on and what it's all about.
You oppose this proposed health care reform legislation, Craig, don't you?
Yes, I am. I'm opposed to this particular bill.
The biggest reason you oppose the House Democratic version is what?
Well, I can tell you from my point of view that I see this as a massive government intrusion into the lives of the American people. And I was going through the bill last night just so that I could be better informed. And I can tell you, Wolf, I went through a very short 5-minute look through this 1,000-page bill, and it only took me 5 minutes to find something that concerned me. Now, if I can do that simply by browsing it on the internet as a layman, then I can understand why there's so much concern for it in the country.
Let's bring in Mary Terry now. Mary, you have a different perspective. I take it you would like to see health care reform passed.
Yes, I would like to see some kind of coverage for everybody in the United States.
Tell us how you think that could be done based on your understanding of what's out there.
I don't think we're there. So one of the things I said to the senator was, I agree that we need to slow down, we need to rethink it. And one of my concerns is everything that has been talked about has been mainly around how do we pay for it and how do we get insurance for people. And one of the things I'm concerned about is I think we need to take a deeper look at it and make sure that we understand how we can reduce costs, because the problem is it's just too expensive. And if we could reduce costs, then I think everybody would be willing to make sure that there was more comprehensive coverage. We're a bunch of smart people here in America. We've done many things that have astounded the world for decades, and I think we're smart enough to look at a system that can make sure that we can provide basic health care for everyone and provide a system at the same time that would allow those that can afford to pay more to get insurance to pay for more.
Were you satisfied, Mary, sorry for interrupting, were you satisfied with what you heard from your Senator Grassley?
I respect Senator Grassley very much. I am a Democrat, but I've always voted for that man. I was a little bit concerned because I did not walk away feeling like that he really understood what the issues were in terms of having comprehensive health care. I think he was looking way too much at the money, way too much at we can't add things at this time. And quite frankly, it's a system that's broken. If we don't look at it now, it's only going to get worse. I'm a financial advisor, have been for 25 years. 25 years ago, nobody talked about health care and whether it affected their retirement. Now people come into me every day and say, I cannot retire because I cannot afford health insurance until I'm 65.
Craig.
That dreaded national plan that nobody wants.
Let me bring back Craig. He's going to get the microphone. Craig, were you satisfied? Are you satisfied? Are you happy that your Senator Grassley, Republican of Iowa, is working with some Democrats trying to forge a compromise piece of legislation out of the Senate Finance Committee?
I can tell you that the Republicans of this state of Iowa are sometimes a little bit suspect of Senator Grassley's negotiations, so to speak. I think that he has the integrity to be looking out for the people's best interests, and I respect him for that. I thought that the answers he gave today were answers and not just your regular political spin. I was a little bit concerned about the answer that he gave when he was specifically asked if Congress would go on this plan, and it was a yes or no question, and he kind of danced around it a little bit. But overall, I think that the senator is listening to his constituents, which is why we're trying to be respectful and civil at these meetings. And I hope that when he goes back to Washington, he will take our concerns, which I think are legitimate, and I hope that he takes our ideas and he is able to negotiate with the opposing party to get something done that will work for this country.
Craig Stevens of Iowa, Mary Terry of Iowa. Guys, thanks for sharing your thoughts with us. This debate obviously is going to continue. Appreciate it very much.
Thank you, Wolf.
Thank you.